This is very much a pay dispute. It is ridiculous that our newest trained doctors are making £14 an hour, £15 an hour when they start their careers, that they're providing life-saving care. Their hourly rate should be increased to £22, £25 an hour, and that is not an unreasonable demand in any way, shape, or form. We are seeing record numbers of doctors who are unemployed, record numbers of us who desperately want to join a training program. I would love to become an A&E consultant one day, but I can't, and that is because government funding cuts to the training program. And so not only are they denying patients, the doctors of the future, to care for them, they are also denying us our dreams. And I don't blame any doctor that spends years working in the NHS and in order to fulfill their dream feels like they have to leave. I don't blame them at all. And we need government to respond to this crisis by having more doctors, more nurses, more allied health professionals, more funding. They need to restore the $400 billion that was lost. We need to restore the 100 A&E departments, the 25,000 hospital beds. We need to end the staff hemorrhage, and we need to fix the social care. The problems in the NHS are solvable. The staff crisis is one that we need to fix now, and we can do that by restoring pay and by increasing training spots so that we have enough doctors in the future to care for the patients that need us. It is such enormous disrespect from our health secretary, calling us moaning minis and juvenile delinquents, saying that we are acting like a cartel because we are fighting to have more patients being seen by more doctors. We are in a bit of a crazy situation where we have the worst waiting list in NHS history that was inflated to such a terrible degree because of terrible government policies from the previous government. I understand that. They've had a year and a half in government and they are not bringing the waiting list down. They're not doing everything that we absolutely need in order to solve this crisis, in order to improve patient care and to bring these waiting lists down. Any good health secretary at this moment in NHS history would ensure that we do not have any doctors or nurses unemployed. This is an all-hands-on-deck moment in NHS history where we need everybody on the front line fighting for patients, improving patient care, bringing these waiting lists down. And it's shocking that we have the longest waiting list in NHS history. At the same time, we have historic levels of doctor and nurse unemployment. That is unacceptable, and that's why we're fighting back.